Good morning, everybody, and welcome to the BIA's weekly COVID-19 coronavirus update webinar. Thanks for joining us today. Today's focus is on managing through the crisis and planning for recovery, with a special focus in on financial issues. We've got some stellar guests on the bill today, two of whom are already with us, and Charles will be joining us in a few minutes. So let me just introduce our guests while they're on the webcam, and I think you guys are then going to flick your cams off. So first of all, Max Herrmann, who is, well, most recently Chief Financial Officer of Reviral, a UK biotech company, but now Pharma and Biotech Managing Director at Stifel Financial Corporation. Morning, Max. You're on mute, but we can see you saying hello. And then secondly, Sam Taylor, who is a partner at PwC, focusing very specifically on the life sciences and technology sectors, works with many clients out of Oxford and Cambridge. I think you're based in Reading yourself, aren't you, Sam?
Yeah.
So very close to our community. Welcome and thanks both for joining us. Our third guest, Charles Waddell, from our member law firm, Pinsent Masons, will be dialing in shortly, and I'll introduce him a bit later on. So you guys can flick off your webcams now if you like. Now I've introduced you. While I turn to Steve, our CEO, who's going to join me to go through a bit of a news update. So morning, Steve. Here's the agenda for today. So we're going to do our usual 10 minutes on what's happened this week, aren't we? And then I'll turn to Sam, Max and Charles to have a look at some of the kind of the financial landscape issues and where we might be going over the next few months as we get through this. And then as ever, we're hoping to pull in lots of questions from you, the audience. So have a think about what you might want to talk about, what you want us to talk about, any specific questions you have relating to finances, deals, managing cash flow issues, investor perspectives. We've got some real expert opinions on that today. So do start throwing your questions in as we're talking on any of these topics. We'd love to hear from you, and it just makes it a little bit more lively and interactive if we can hear from you, the audience. Just a quick reminder, we'll be live tweeting today on the webinar. BIA webinar is the hashtag. Our colleagues in the comms team, Shannon, will be picking up what's said. So if you want to join in that on Twitter, do please get involved there. Hopefully that's okay in terms of an intro. Turn to you, Steve. Morning.
Good morning, Michael. Morning, everybody. Thank you very much. It feels like it's been another busy week of latest developments, and I think in 10 minutes, if I can run through a perspective from the life science industry of what we think matters, I hope this summarises it and enables you to get more time looking at more useful material. But this brings you a summary and a snapshot of both what's happened and, interestingly, this week, what's not happened. So shall we dive straight into it, Michael?
Yeah, so we're starting out at the global level, aren't we, Steve?
Yeah, I mean, on Monday there was this big EU get-together with world leaders pledging 7.4 billion to research COVID-19 vaccines and think about the response. So I think that that's an important part. Is really where CEPI, Gavi, the UK government, others, well, WHO have come together, and pharmaceutical companies. So it's not something we've been directly related to, although we have put our manufacturing community in touch with CEPI, and we're obviously close to many of the groups, particularly the UK groups, Wellcome and others who are involved in this, the UK government. So I think we're watching this very, very closely. It looks like it's forming. It's clear that not everybody in the world is engaged in this, which is a shame. And you've seen the concerns about that from Theresa May, the former Prime Minister, and Tony Blair, the former Prime Minister of the UK, both wanting there to be a global response. So I think we're aligned to it, and I'm the chair of the International Council of Biotech Associations, and we are making a play to be engaged as a series of biotech associations with this agenda, so that we can understand it, so that we can contribute to it, and so that we can be part of the agenda as it moves forward. So one to keep an eye on rather than one that's got practical impact this week for people.
Yeah, absolutely. And we've pulled out a few things that are going on more locally, haven't we, in terms of kind of, well, I don't know, move this slide forward. See if I can do it like that. There we go. So a couple of member company kind of developments this week at the top there, Steve. Scancell and Precision Life. Talk through those. I mean, it's interesting.
I'll go back to that one because I want to talk about the. So I think the science is developing at pace, and there's lots going on in our ecosystem. Can we go back to the one? So yeah, I mean, I think what's interesting is people are now looking not only at pure play vaccines of the adeno or the mRNA virus, but I think people are looking at whether T cells and neutralizing antibodies, and the antibody thing seems to be coming. Obviously, Jane Osborne's been leading the task force on that, but there's some interesting things going on in the ecosystem there. I think it's fantastic to see AI-enabled precision medicines platforms being used to identify candidates, working off the fantastic work at UK Biobank. So you can see again the science infrastructure of the UK and some of the work that we've done in the past, being able to look at new types of ways of discovering and thinking about therapeutics going forward, whether it's with COVID or other things. BioNTech and Pfizer have done their sort of close behind Oxford on their phase 1/2 trial of their vaccine, and again we're seeing I think more play globally on neutralizing antibody. This talk in I think it's in the Guardian, wasn't it, of Israel studies claiming to have created neutralizing antibodies. I think staying up on this and understanding how this is going is really interesting. There's lots of people in our community on it, and it just shows that week on week things are moving at hyper speed in terms of the science in this space.
Yeah, absolutely. In terms of government action this week, I mean, a lot of talk about preparation for the 3 T's, test, track, trace, difference of opinion about which order you put those words in. And then a lot of kind of quite machinations about whether the UK's decision to go with a kind of a centralized app system is the right one. And that's even moved overnight. Interesting story in the FT on that, wasn't there, this morning?
Yeah. So I think on testing, obviously we've seen the government celebrate its hitting of the target it set for itself last week, but this is still under development. And I think if you're interested in testing, there's a more detailed webinar later today we'll talk about with all the other trade associations, and we'll get into some of the detail of how the population-based stuff is being looked at. And we've got some new requests out for crowdsourcing of innovative ideas to speed up the testing in the UK context and in the scientific context as antibody developments continue. I think you're right to highlight the linkage of that with the upcoming NHS app is part of the big UK push. But it does seem that the app itself, under test in the Isle of Wight for the first time this week, may have some teething troubles. You'd expect that with any app. And then there's this big, are they still fixed on a centralized approach, or is there a decentralized approach, which was obviously the Apple and Google way of thinking about it, how the Germans changed a week or so ago. Is there a sort of second tier on this happening? And I think staying up on this, because obviously you have to then link the digital back to the testing, will be important. And I know there's many companies interested in digital health and how it works, and that's why we're keeping people's eyes on this as it develops, because it's going to be part of the new prevention and testing landscape going forward.
Yeah, so it's Bank Holiday weekend, Steve, isn't it? And we're looking forward to a much trailed announcement on kind of, the next stage, softening some of these lockdown rules. And we saw a leak earlier this week of some of the guidance that government's developing to enable businesses to get back to work, but it's still not going to be business as usual at any level, is it?
No, I mean, I think it'll be strange Sunday afternoon, Sunday evening viewing with the Prime Minister pledged to make his announcement there as to what might be the changes. I think we've had some insight into some of the thinking. So if you are running a business, expect to see some government announcements on Sunday. I think that they will be enabling rather than prescriptive, but let's wait and see what actually comes out. But I think we will move to a period where we will see some expectation as to what might be the future. I don't expect everything to move on Monday, but there's speculation in the press that some things could change quite rapidly, and I think we're starting to see the shape of the government's thinking as to how the UK may move from its current position to a new position, and we'll update and make sure that as that guidance comes out, it's available to members probably beginning of next week.
Yeah, that's right. I mean, I've already seen that there's stuff in there covering offices and sort of factory spaces. We know that they're working up separate guidance covering laboratories because they actually got in touch with us and others on that. So yeah, I mean, it'll be reasonably detailed, but perhaps not covering all of the specifics. I mean, I get the sense that they're going to, allow employers themselves to make decisions about how they can reasonably reduce risk and kind of manage this stuff. What we know from previous webinars, the feedback we've had from people on these before, is that a lot of our businesses in our sector are already managing fairly effectively through this, haven't we, Steve?
Yeah, I mean, a lot of people have kept have changed practice in labs and know how you're working, and perhaps it will be interesting to reflect whether that's seen in how the guidance works. Many people have gone to working virtually, and offices, I think, are likely to continue to work virtually. And then it's linking it all together, isn't it? What's the how's childcare going to work? How's transport going to work? And all of those bits. But I think be ready as a business leader that that there will be a slug of this stuff next week, which will probably result in questions. We'll explain what the government guidance is and provide a chance to chat about it. And I imagine it's probably likely to be a lead time between the guidance being issued and people being able to operate against it. But we wait and see, but be ready for this Sunday, Monday.
Yeah, okay. Well, I thought we could just do a quick poll of the audience on this question. I mean, I realise that the guidance isn't available yet. You may have seen some of it in the media. The BBC ran the story earlier in the week. But why don't we have a go at this question? Just sort of, I suppose I'll just ask you to answer it in a kind of the spirit of where we're up to. Let me just launch this. So the question is, in terms of managing risks of transmission and maintaining social distancing in the workplace, I mean, I think what we say is, based on what you know so far, do you think your organisation can maintain full activities on site, most activities on site, some no activities, or it's just not possible to stay at this stage? So have a go at that. I realise we're kind of working on partial information, but it'd be interesting to see, when it's Steve, what broadly people are thinking at this point.
Yeah, and I think if you're staying fully virtual, then that counts for me as no activities on site. You may already be fully virtual, and you'll plan to continue to be fully virtual. It'll be interesting to see whether people are inspired by Parliament, which has gone to a mixed model.
Yeah, that's right. Okay, give it another couple of seconds. As ever, we all seem to get up about 2/3 of people voting on these, Steve, but I'll close it when we get to that point.
Yeah.
Okay, I'll go now, I think. I'll just share those results with you. What do you make of that?
That's interesting. I think that's probably against my prejudice. I thought we'd see more people being in the fourth bucket, no activities on site. It's interesting that half of you think there's going to be some activities, and quite a lot of people are in the most, with a very few full activities. So interesting to see. So I think that guidance will be interesting, and probably one that we need to discuss once we've seen it.
Yeah, absolutely. But on the subject then, so the next slide really kind of relates to that, Steve, if I can just get the system to flick forward. Apologies if this goes too far. There we go. So in relation to that, we've seen a letter come out of the last 24 hours from chief medical officers and the NHS medical director about kind of clinical trials operations, have we? Do you want to talk through this briefly?
So I think this is one of those things that has come to us from members. Many of you have encouraged us to keep the lifeblood of clinical trials, which works both for patients and for our sector, flowing. And it's good to see that all 4 CMOs have written out encouraging the system to make sure that there's both recruitment of patients into clinical trials with COVID, and also you see here it's important that this other research continues, subject to it not having a negative impact on the system's ability to recruit participants and provide the resources needed to support priority clinical studies. So it's good that they are encouraging research to continue or get back up and running as an early part of this. And I'm hopeful that we'll see some more guidance from NIHR on restarting clinical trials next week. So I think they've listened. They understand the importance of this for patients, understand the importance of this for us as a sector, and it's good to see both a letter this week and consultation on further thinking, which again I think we'll see more of next week. So you asked us to make sure clinical trials was a priority. We've pressed that with the government, and you can see that this is starting to come back in terms of the letter and the hopeful guidance soon.
Okay, good stuff. The last slide in this intro section, Steve, just relates to where we're up to in terms of government support schemes.
Yeah, I think I said at the beginning that sometimes it's the dog that isn't barking, or it's the news that hasn't been announced that's as important as the things that have been announced. And I think that this week we've seen the bounce back loans detail announced. I don't think we're seeing that on the slide yet, but maybe we can. They've gone live. We've gone through it. We'll go back to it. But the thing that we haven't seen yet, that we had hoped for and have asked for, is we've not yet seen the Innovate UK competition for the knowledge economy made public. That will be part of the of the announcements expected in the coming days. So we're hopeful for that, but we haven't got that yet.
Yeah, I mean, bounce back loan seems to have been a fairly decent sort of success so far, way more so than the large business interruption loans. 69,000 applications on the first day. I mean, seems large, doesn't it? I don't know whether if anyone has had any experience of bounce back loans and wants to comment on it, do stick a point in the question box on this. Just on the left-hand side of that slide, Steve, just to note that the government's kind of got a kind of a support finder tool going up on gov.uk, which just allows you to kind of navigate through the various schemes which have been launched. And that's just an extract from the graphic there showing what's suitable for which types of companies. But I mean, we've done quite a bit of this in detail over these webinars the last few weeks, so people should hopefully be fairly familiar. Yeah, I'd be interested to know if anyone's had an experience of bounce back loans. It's fairly small, but large numbers so far in terms of applicants. Okay.
Yeah, no, thank you. I mean, I think, from my perspective, we keep going on this. If you need more information or us to discuss it more, then let us know. We think the Future Fund we explained a couple of weeks ago, bounce back looks fairly straightforward, although it's a loan and and small numbers, but may be helpful. VAT deferrals seems to be pretty popular, and people seem to be working on that fairly simply. And we know that many people have used the furloughing or job retention schemes as well. But we still wait for the Innovate process, and I know that's one that people have been waiting for. We hope to be able to talk about that in the coming days. With that, I'm going to hand over and to the expert panel. And Michael, thanks very much.
Thanks, Steve. People may have noticed that I'm having slight issues getting the slides to move forward exactly when I want them to. So apologies for that. I've just got about it seems like a 10-second delay on me doing something on my computer and then flicking forward. So apologies for the slight technical glitch. I'm just going to try and move us forward to the next slide. There we go. Okay, so right, it's panel discussion time. So I'm going to start, Sam, with you. And I just see we've been joined now by Charles, so I'll just give you a chance to say good morning, Charles. Thanks for joining us. Hopefully you caught some of that news from Steve. But in terms of kind of the order, I think I'm going to go Sam, you first, then turn to Max, and then Charles will follow up with you. To a certain extent, though, I feel like each of you is well placed to comment on each of the questions that I'm asking. So do please feel free to kind of come back in on any of the points that I put to each of you, if you've got a particular perspective on it. So Sam, you're working a lot of working with a lot of life sciences companies at the moment, and I think you have a decent kind of perspective on how things sit across the kind of the economy more broadly. So I suppose my first question to you is, what does the economic outlook look like? I mean, clearly, a lot of the data that we're seeing from, the big business organizations, CBI, Chambers of Commerce and stuff, are talking about significant impacts across British industry more broadly, and certainly very extreme impacts in certain sectors. But from a life sciences perspective, where do we sit in that mix, do you think, in terms of kind of the economic outlook, in terms of the immediate impact of COVID-19 on things?
Yeah, and as a firm, we've been running on a weekly basis kind of economic updates on what's happening to the economy more widely, and drilling down into sectors and providing predictions as to what we think will happen in the rest of 2020 and in 2021. And as you say, across the board, that gives a decline in both 20 and a slight recovery in 2021. The declines that we're seeing in 20, clearly some of the industries, as you would expect, some of the entertainment and travel industries are really hardly hit. The one sector that does stand out is the health sector more broadly, where we're actually seeing we're predicting a 4 to 6% growth in the health sector. Now, clearly, life sciences is a part of that health sector, and I think that you need to drill down into some of the details, some of the individual companies within that life science sector itself to work out what's actually happening. I guess what we're seeing from a high level in the sector is that there is still a significant amount of money. We don't think the amount of money being invested or available to be invested is actually decreasing. And in fact, in some areas, you know, the classic ones are things like diagnostics, which the crisis really has thrown the spotlight on the diagnostics industry, and we're actually seeing more interest from investors in investing in a number of different diagnostic companies. We're also not seeing, I guess, looking forward to the public markets, and when I talk public, it's largely US public markets now. But the demand for companies to raise money on those public markets also isn't decreasing. There may well be some delays as the equity story of some of these companies is delayed as various trials or results of trials is delayed. But actually the underlying sentiment that there is still money there and still people willing to invest is absolutely there. I mean, recently we've seen some, I think across April we saw 5 biotech IPOs on NASDAQ, and some of those, Audit and Lyra, are a couple of great examples where those were heavily oversubscribed. And so there is still demand, there's still money that people want to put into biotechs. We also saw, you know, I guess European specific, we saw some really encouraging crossover rounds in April as well. And last Monday, Compass Pathways in the UK announced that they'd raised 80 million with some US investors coming on board, $80 million. And again, an oversubscribed round. So it shows that the money is there, and that whilst companies are being affected, the overall finances, the picture is still pretty positive.
Yeah, but I mean, how many of those deals were already in the pipeline, Sam? I mean, are we just seeing those kind of play out, you know, notwithstanding the current disruption?
Yeah, and I think there's a combination, to be honest. I think that, you know, some of those had happened, and what we're hearing from companies is that if they had initial conversations with investors, then actually moving to a virtual world has actually not caused them any problems, and in some aspects it actually makes things easier, because you don't have to trek around the East Coast, trek around the West Coast. You can actually just move from one investor meeting to another virtually, which is in many ways a lot easier. But that is dependent on you having had contact with people in the first instance. I think the reality is it's a lot harder if those conversations haven't started. And I guess what we are seeing is there are companies who have been caught, I guess, at the unfortunate place in their funding cycle, and those are companies who are finding it more difficult to. It'd be interesting to hear Max's view later on, but we're hearing that those companies are finding it more difficult to start up a funding round almost from scratch.
Yeah. So, well, how might this affect then companies looking for new finance, say in the next 12 months? I mean, I know 12 months feels like could be very different from 3 months versus the next 6 months versus maybe as we come out of this. What's your view, though? I mean, if a company's, you know, looking to raise money, I mean, so no face-to-face meetings possible. I mean, where do they stand then? I mean, are we talking about basically people trying to sort of economize and kind of reduce expenditure short term, come back to it later, or can they get going now?
I think a lot of it, there is going to be a massive divergence company to company. So I think that there will be companies, as I said, who are at the wrong place in their funding cycle, who I think their current investors will face a decision around valuation, and do they put more money in to keep the company going until, you know, the next phase of clinical trials or the next inflection point can be reached, and therefore the valuations achieved that they want. So some of the investors, you know, won't be in that position to be able to do that. They might be in a fund which is already kind of maxed out, and so you'll see some interesting discussions, I think, with some, you know, probably more private placements than we are used to seeing, with a smaller number of investors putting more money in. As I say, I think it's really hard to generalize, because there are, you know, each company is at a really different point in both its operational cycle and also its funding cycle as well.
Okay, well, I am going to come back to that question perhaps to Charles shortly, but just to finish off with you, Sam. So, I mean, I don't know. You're a partner in an advisory firm. I think you focus specifically on audit. But I mean, if a company came to you worried about, I don't know what you're going to see when you're doing your audits later this year. But if a company's looking at cash flow issues over the next few months, what's your advice to them?
I mean, I think when you said some companies will come to us with cash kind of issues, I think this affects almost every company. And the critical thing for me, I guess, are a couple of things to pull out. And most companies will already be aware of this now, but it's a constant monitoring of that cash flow cycle, because things will change dramatically. I mean, hopefully we will receive some positive news from Boris about kind of easing of the lockdown, but there's still some uncertainty for companies around furloughing of staff, unfurloughing of staff, and what happens there. So it's a constant need to look at the cash flows, you know, both in the short term but in the medium term as well. I think from an accounting perspective and an audit perspective, we are expecting, and we're already seeing, a huge number of companies who are issuing statements in their financial statements that are alluding to the fact that there is a great deal of uncertainty, and therefore from a going concern perspective, people don't know the full picture looking out for the next 12 months and beyond at this point. And so from a, you know, there are more references in audit opinions than we are used to, and that's applicable both in this sector but a lot more so in some of the other sectors as well.
Yeah, absolutely. I mean, I don't know the detail because we haven't done a survey, but my impression, based on the feedback we've had in previous webinars, is that the life sciences sector hasn't perhaps taken advantage of things like the furloughing scheme as much as other sectors have. I mean, has that been the right move? Should businesses have looked to try and reduce short-term cost pressures a bit more than they have? I don't know.
I mean, it's a really interesting debate, actually, and we're following the data quite closely. Again, we look at the health sector more broadly, and the health sector is the sector that has used the furlough scheme less than any other sector. I think there's a question around, you know, a couple of questions that it raises. The first one is the financial perspective around, you know, as you said, should companies be using this? Can they get productivity from their people when they're not at their workplace? And I think the other interesting thing is a moralistic point, that you know, should companies be using this if they really don't need to? And I know that's something that we as a firm grapple with. I know a lot of other companies in the industry are as well. I think that, again, it's an individual company decision, and it's really specific down to how much is it impacting that specific company. You talked about some of the schemes that are coming in, which are quite low value, which have had a huge amount of take up. I think it's really hard to generalize and say, right, well, this firm should have taken advantage of these and others shouldn't, without knowing the full details.
Yeah, okay, good. I've just got a quick question here, which is specific to you, Sam, so I'll throw it in now. A question from Richard Turner. Are audit firms changing their approach to auditing going concern, the information they require as a result of COVID-19? So has it changed your approach?
I mean, we've heard quite a lot of noise around the sector, actually, that other firms are kind of implementing different procedures. So I don't know about those. I can say what we're doing as a firm. I don't think our procedure has changed. I just think that there are more companies. So our procedures have always been that if a going concern assessment is tight, or if there are significant judgments in it, then we will look at those in a fair amount of detail, and we will consult with other partners where we feel necessary. The reality is that there are more companies in that situation, and therefore we are doing more in relation to going concern than we were 6 months ago. So our procedures haven't changed. It's just there is more to do on more companies. Okay.
Good to know. Hopefully that answers your question, Richard. If not, just drop another question in the box and we'll pick it up again. Okay, good. Thanks, Sam. I'm going to turn now to Max. So, you know, Max, you've got huge experience as CFO. You know, you'll be able to relate to the experiences of a lot of the companies that will be onto this call. So, I suppose my starting question to you is, you know, I suppose maybe I should leave open the possibility it hasn't, but you know, what, if anything, has really changed for you UK biotechs as a result of COVID-19, and maybe what hasn't?
So I think everything has sort of changed in terms of how they operate, how they, you know, the funding environment has changed. I don't think there's anything. I mean, it's changed for every business, so I don't think healthcare, the healthcare sector and biotechs are any different to that. I think the one aspect that has been different is that the sector has been one of the most resilient, I think, as Sam said, to the impacts of COVID-19, and there are fairly discrete areas where the industry has been affected. So, for example, in clinical trials, clearly, I think Steve highlighted it earlier on it, that conducting clinical trials has become very challenging in this environment unless you're running a COVID-19 study, where it's become incredibly rapid, and you're seeing timelines for clinical trials that are unheard of, really. So that's clearly impacting. I think those things tend to be longer term. So if you were planning to, perhaps your budget was to spend, 10 million sterling or whatever on a clinical trial, a large scale clinical trial, or whatever the amount, you're probably going to spend that over a longer period of time, because you're not spending that initially here, because your recruitment rates have gone down significantly or are frozen at the moment. So that shouldn't, if you had cash as a biotech company for maybe 2-3 years of funding, that shouldn't be too big a problem in the near term. It does mean that completion of that study is going to end up being escalated over the original amount you budgeted, and therefore it does leave potentially a shortfall in your earlier funding rounds and the plans for that. Probably more impacted has been the operating businesses. So the companies, and we've seen this definitely in the public markets, where the life science tools companies have suffered significantly because academic labs have stopped doing research. And so if you're providing that type of company with the tools, or that sort of academic group or pharma company with the tools to do research, that's slowed down significantly. So that's clearly been impacted. Getting into labs for the scientists has been more challenging with social distancing impacts. So I know certain large pharma companies have stopped the bench work that they're doing. Others haven't. So it's been a bit of a mixed picture there. So I think everybody's being impacted.
Yeah, what about this? So it's interesting. Steve and I were on a call with the ministers earlier this week, and there's kind of big talk now about the future of the UK diagnostics industry. I mean, is that one of the opportunities that we can see in all of this?
Yeah, I think that was being pretty clear from the get-go, that the UK industrial base from a diagnostics perspective was wholly inadequate, and I think that's something that the government will clearly address in an industrial policy. I've actually been relatively pleasantly surprised at how the small diagnostic players that we do have responded to COVID-19. So we've seen a lot of the diagnostic companies develop COVID-19 either in the molecular diagnostic tests, so PCR based. Novacyte has signed a collaboration with Public Health England, or an agreement with Public Health England, to do about 41,000 of their target 100,000 tests. So that's been a big contributor to that from a very small company. So we've seen companies like Yourgene start to use their capabilities to help manufacture for others who have the tests. And also in serological aspects, in the antibody tests, we've also seen companies try and evolve either kind of lab-based tests or point-of-care tests. So there's definitely been significant move there. How the industry, how the government then decides to try and support diagnostics industry post this is going to be interesting. I mean, I think we will need to set up some sort of funding organization like in Europe, the EIB. Obviously post-Brexit, we don't have access to the VC funding that the EIB used to provide as an LP to most of the European biotech venture funds. I think we need a UK sort of approach where they will support UK VCs to fund specifically the diagnostic industry. That would be my thoughts on an approach, but we'll see.
Yeah, absolutely. I mean, that's maybe for the future. In terms of what the government's done so far, I mean, just as an observer on all of this, I mean, in terms of what our industry needs, what's been your take on the government response to date? I don't want to put you too much on the spot, but, give them a score out of 10, I don't know.
I don't know. I mean, I think these, obviously there's a difference of approach between the US and the UK, between paycheck guarantees in the US and the furloughing in the UK. So there's different nuances in how you apply that. I'm not sure. There are pros and cons of both. I think that's certainly been helpful. I think these loans, that's just too small a loan to really impact many. Yeah, that I think would be too small to impact.
And what do you think about the kind of the prospects of these future fund loans, the convertible loans? I mean, we still don't know very much about them, though, do we?
No, I think probably more importantly, I believe the R&D tax credit, they were going to implement this cap on the national insurance payments and PAYE payments to 3 times the level contributed, and I think that's been deferred, and that's clearly helpful, because as a UK R&D intensive company, that's a really key cash source for the business. Generally way more than the 50,000 that you could get for these bounce back loans.
Yeah, absolutely. Just had a comment. Thanks, Martin, for your comment in the chat box, saying a lot of this is down to Steve and Martin's lobbying directly into the Treasury on that. So I better mention that, otherwise he'll kick me afterwards virtually. Okay, good stuff. Well, I'm going to turn to Charles now. Thanks, Max. I'll come back to you with any questions that we get in as well. So do please fire in your questions. You're going to struggle to find such an array of expertise and experience in terms of managing finances and deals in terms of life sciences sector landscape. So do please think of some questions to throw in. I'll put them to our guests. But turning to you, Charles, so I mean, you're working in a similar space, but obviously from the legal perspective. I don't know. I mean, it's an advisory kind of question again. So, I mean, if you were sort of, Steve put this up front, didn't he? If you're in the lift or in conversation with a CEO or a CFO of a biotech company, what's your kind of advice to them in terms of getting through this in good shape, would you say?
So a good question. We're getting a lot of questions about cash runway, because clinical trials are being delayed for our R&D companies. So it's having that. I mean, quite often if companies suddenly find they're not going to get a readout in a clinical trial when they're expected, which is then going to enable them to do their next funding round, there might be only 6 months notice of that. We've got clients who are anticipating that a readout in a year's time is going to be delayed. So they're putting in place financing facilities now with their VC investors to extend that runway. They're just being upfront about it and saying, we know there's going to be a problem. We're going to need another 6 months to 12 months cash runway to get to the value inflection point, which will enable the next round to take place. And in those discussions, we're trying to factor in how the future fund might be structured so that people can draw upon that facility if they need to. So I've been giving an awful lot of advice on what is essentially a 2.5-page document and trying to second guess what the final terms are going to be.
Yeah, in that space. But I mean, if what we're saying is the investors are broadly going to manage this period, I mean, a lot of people talking about kind of 6 months. I don't think it's a magic number of months, is it? But if we say there's a period where existing investors are going to have to, kind of manage through this, does that mean at some point in the future we're going to see a dip in finance available within our sector?
I mean, obviously, VCs, they ring fence particular pockets of money for each of their portfolio companies, and if they haven't got enough to to meet the additional demands of the existing portfolio companies, they may struggle, and that feeds through into the dynamic of pricing these sort of bridge extensions. If one VC's got more money in the pot, they may throw their weight around. Having said that, most of our clients have a sort of a syndicate of VCs in who behaves fairly sensibly. But if you've got some of our clients only have one VC on financing them, and then you never quite know how they're going to react for a request for more cash. And one of the slightly depressing things we're getting is we give a lot of employment law advice. And we give a lot of advice as people went into COVID. We're now giving a lot of employment advice as to what happens when we come out of COVID, the initial lockdown and safe distancing, etc., in a health and safety context. But then what happens if we go into another lockdown, and people are already considering how that's going to impact upon their business.
Well, what's your advice to people if that does happen then? Sorry to put you on the spot. I mean, that's the question. What's the answer?
Well, in that scenario, as a financing lawyer, I'd also say cash is king. The more cash you've got on your balance sheet, the better place you are. But that's a scenario which people are already contemplating.
Yeah, and what about the bigger picture, Charles? So Sam earlier, he said that his survey work, well, PwC survey work, suggesting maybe even 4 to 6% kind of uptick. I can't remember the timeline that was on, Sam, that your survey covered. But I mean, do you agree with that? Does that chime with what you're hearing?
Well, well-placed law firms have a sort of counter-cyclical approach to life. So sadly, I was speaking to one of my litigation colleagues yesterday, and he's seeing a big uptick in inquiries coming in. Sadly, one of the things which happens when there is a down, if people's revenue goes down, is they start looking at existing contracts to see if they should be litigating particular issues. Pinsent Masons has the most visited legal website in the world. It's called Outlaw, and we've seen traffic go up 150% since the lockdown started, as people are looking for answers to questions.
What sort of questions are they asking you?
Force majeure has been the most popular one. If you type in force majeure into Google, the first entry is what Wikipedia has to say about it, and the next entry is what Pinsent Masons got to say about it. So we've been giving a lot of advice on commercial contracts in that context.
Yeah, this is an interesting question. I mean, there's actually been quite a lot of debate in the public media about that as well. I mean, okay, well, I mean, is that? I mean. Is that a real problem? I mean, I suppose I'm broadening the question out here, right? So what are the big challenges? Is it around contracts? Where are people going to struggle over the next 6 months, and where do you think they'd be best placed to turn their minds to?
Is that a question for the panel or for me? I mean, I would say, financing, you can never have too much cash on your balance sheet if you're a small biotech or medtech company, whether you're private or listed.
Yeah, okay, good stuff. Well, I'm going to broaden it out to Max and Sam. What do you think?
Yeah, I would second that. I mean, we've seen in certainly the public markets, people raise funds now. There has clearly been an acceptance by institutional investors to support companies who want to either strengthen their outlook because they think there'll be some opportunities for growth going forward, or alternatively in a more defensive measure to strengthen and shore up their balance sheets because they don't know how long and how deep the pandemic will impact their operations. So it's been there's been a lot of fundraising going on from a lot of companies in life sciences in the UK over the last 4 weeks, and the institutions have generally been very supportive.
Yeah, I'm just going to go back to where we started. Sam, you mentioned about kind of raises in the US markets. I mean, I'm just conscious that COVID-19, whilst it's a global phenomenon, hasn't seen a global response. We've seen quite different responses from different governments, and therefore, different impacts on different economies. So my final question to all of you really is, how is the UK or UK life sciences companies going to be perceived relative to other global destinations for investors, for global investors? So what are the strengths and weaknesses of the kind of the UK response to COVID-19? I mean, is that going to change the way global investors perceive the UK as a destination for investment in future, do you think?
I guess if I jump in first, I think that it will impact countries differently, and I think it's really the way that it will impact is based on the way that those companies are set up and what their strengths and weaknesses are. The UK has been and will continue to be a hotbed for academia in the sector, and that's not going to change because of COVID-19. And so, in terms of the the level of intellectual property coming from the UK, that will continue at a similar rate. I think that what we will see is a delay in how some of that is developed. The US very strong in the in academia as well, but a lot stronger in the later stages of financing, and so you'll see a different impact on those territories. But I think actually in the longer term, it will play to the strengths, the academic strengths that we have and the commercialization of that intellectual property that we do have in the UK. And I think it will mean that in the long term we will cope well.
Yeah. Okay. Max, what do you think? Pros and cons of the UK's response to COVID-19 and impact for investors?
I think there's a number of levels. I mean, clearly the US will remain the main pharmaceutical market, and that will remain key. And so actually the reality is what happens in the US from a commercial perspective is more important than what will happen in the UK. I think the UK's response from a government perspective, or the mortality rate in the UK now, is not good publicity, clearly. But I think there has been, from the life science perspective, I think as Sam said, there's been some huge positives to take. From the diagnostics industry, the ability to adapt very quickly to the pandemic and actually try and address it has been pretty impressive. I think in terms of the vaccine approach, that's obviously been impressive as well. So I think that's plays to the strengths of the life science industry in the UK. And that will be good from an investment perspective. Long term, commercially, you're always making your money in the US in pharma and most likely in diagnostics. So that is really still more dependent on how the US addresses it. But from the UK industry as a source of technology, I think that's been strengthened probably by the response of the UK life science companies to the pandemic.
Okay, good stuff. And final word to you, Charles.
Yeah, we're anticipating post-COVID, people are going to be looking to shorten supply lines and bring manufacturing back on shore, which creates is going to create an opportunity for the UK.
Okay, good stuff. Steve, you've appeared back on my screen at the perfect time, as if by magic. So going to give you a sort of a right of reply against, fascinating comments there. Some interesting perspectives. Certainly some challenges, but broadly speaking, a positive outlook, I think, is my kind of slightly layman's summary of what we've heard from our experts. What's your take on all of that?
No, I thought it was really useful to hear what's going on at the coalface. It's good to see that continued financing is happening, Max, and great to see that the recognition of the speed of adaptation of the diagnostics industry, which I think has an interplay with many of the science-based companies that have been thinking about antibodies or other things in the broader base that have engaged really well. I'm glad that the issues that matter to companies are some of the ones that we've been on. R&D tax credits, the importance of getting clinical trials back up and running, whatever they're in, and making sure that people have an understanding of that. And you can see that we're pushing on that. And I agree. I think it's important that the sector is able to demonstrate what it can do. And in a sense, unfortunately, though it is, this crisis is a shop window for the sector. I think it's vital that we we press to the global challenge. And I think the vaccines work, the manufacturing work, diagnostics work, the antibody work is all going to that and showing the value that the UK brings in not only in a national context but also a global context. So we're keen to support. We know that there's great companies doing great work, and we're also trying to make sure that companies that are not directly in the COVID space can get going, keep going, and we're hopefully underpinning both the financial things that are necessary, whether that be encouraging the government to do sensible and helpful things. And Max, I think that with the British Business Bank rather than the EIB, there are already some potential ways that we can think about supporting companies. The challenges we had before remain. We still need to grow to scale, and maybe if people are getting FaceTime with investors on the east and west coast virtually rather than stepping backwards and forwards on the plane, that will lead to a new form of business, and maybe that's one to explore going forward culturally. How are we doing that, and what's working for people? Because if people's networks will last for a while, but we'll need to renew those, and we've been at the heart of that sort of connection phase as everybody on the panel has. How do we think about that going forward? I'm positive about it. I think we've got more weeks of this ahead, but I think you can see that there's real business happening in the virtual environment. People are adapting entrepreneurially, and that means there's always opportunity.
Okay, good stuff. Well, I think we're coming up hard against the deadline of the end of this webinar, Steve. So I'm going to say thank you to Charles, Max and Sam. Incredibly useful contribution. Hopefully my questions weren't too naive or awkward. And so thanks to you for joining us. Steve, we've just got a little run in to end the webinar in terms of kind of what's coming up, haven't we? So if I can just go back to you to go through that, and hopefully I can get the slides to move at the right time this time round. So first up, you mentioned this afternoon there's another webinar on testing, didn't you? Should we just recap on that again?
So this is the ones we work with, the ABPI, the ABHI and BIVDA. There is a new update from the government on its webinar on its testing strategy and surveillance. Some new insight, I think, today from Aradazi and others around the population-based studies. I think also some of the innovation challenges. I hope people find that useful. It would be good to get some feedback as to whether those help, and I'll be in that one if you want to join us in the next couple of hours. We'll do another one of these next week, Michael, once we're the other side. And have we got thoughts at the moment where we might be heading?
Looking like we're going to focus on innovation opportunities and digital healthcare again next week, Steve.
Thank you. I hope that you find our weekly bulletin, and you can register at bioindustry.org, where we put things out on a Monday through newscast. If you've got ideas, do suggest what you'd like to see. Our microsite is kept up to date with all the latest stuff, and things are still moving. And if you've got thoughts or comments, do either drop Michael or BIA Events an email.
Yeah, absolutely. And if anyone's on the webinar would like to contribute to a discussion next week on digital healthcare or innovation, do just drop us a line. We might be able to put you up on the bill if that's of interest. And then finally, Steve, just a note on wider engagement with BIA.
Yeah, this isn't the only thing we do. Many of you will know us well, but many of you may not know us. And if you're new to the BIA, we do a number of things, connecting people to make sure that your business can grow through industry-leading events and expert committees. We influence policy to make sure things are the members' voices are heard, and we talked a little bit about how we've done that in clinical trials with the NIHR and how we've done that on some of the rescue schemes that are coming out from UK government. And of course, we have a significant a collective purchase scheme through which members are saving money on business solutions. So do have that a look. If you don't know us and you'd like to get to know us better, Michael McGivern would love to hear from you. Michael's on this email at the bottom.
Yeah, brilliant stuff. Okay, thanks, Steve. Okay, well, that's the end of the webinar. If you've got any feedback or suggestions for other topics we could cover in future weeks, do please drop a note onto the feedback survey, which you'll receive after we close the webinar. Do please give us your feedback. We'd love to hear from you. So that's it for today. Thanks again, Charles, Max, brilliant contributions. See you all again, hopefully next week.
Thanks all. Have a good bank holiday weekend.
Cheers.
Thank you. Bye.